It's Mental Health Month. It's Mental Health Month, and so it's very important that we really deal with trauma. So this week I'll be talking about trauma in children, and next week I'll talk about trauma in adults. And specifically, I'm basically going at the scientific level. I am not a psychologist nor a psychiatrist. I'm not able to diagnose any type of disease. But what I do know is biology and, biomedical sciences, molecular biology. And so I know how to read scientific papers. And so there's been a lot of new data out there that is discussing what happens to the brain when children go through traumatic experiences. And so what you see here on this slide is a mother kissing a baby. And they're in an MRI machine. And if you look at their picture, you look deeply, you'll see that the mother's brain is much bigger. The mother has all these folds in her brain, while the baby doesn't have a lot of folds. It's small, it's undeveloped, and not a lot of those white, areas. But over time, through nurture, and through life experience and through education, those folds increase and that white matter increases. But what we're realizing is that traumatic experiences may hinder that development process. So as you see here from the Department of Health and Human Services, maternal neglect is the most prevalent form of child maltreatment, as well as the most pervasive across time, accounting for almost 80% of all child maltreatment cases. And so we're going to talk about what happens to children when they're traumatized, and specifically what happens to their brain. There's lots of pictures and graphs that I'm going to try to explain to you and try to make it really plain for you to understand what trauma does to the brain. All right, so I'll go to the next slide here. Hopefully it moves. Okay, so what is childhood trauma? What is childhood trauma? Okay, so there was this survey here. Unfortunately, I can't really see it, so I'll read it to you. But about 129 adult patients that have been diagnosed with some kind of mental illness. Okay, they call it the ICD-10 diagnostic categories. So that's panic disorders, stress disorders, schizophrenia, insomnia, alcohol use, like tons and tons of mental disorders, addictions. They surveyed these people, and their average age was 26 years old, and they were admitted to the hospital at least almost two times, on an average of almost 2 times. And what you see here is the people who, of the ones surveyed who have been admitted to a psychiatric hospital at least 2 times, have some kind of neglect. So 40%, 50% of the individuals, right, had peer-to-peer bullying. That's why. They're not saying that's the reason why they're in the hospital, but these are the experiences of trauma that they've received. So what kind of trauma is there? There's emotional neglect. There's parental nonverbal abuse. There's parental verbal abuse. Look, 40% of the people who were in a psychiatric hospital who were surveyed had parental verbal abuse. This is out of their own recollection. Whether it be peer emotional abuse or peer bullying, bullying seems to be high on the list, higher than even what, parents do. Parental physical abuse, 30%. These are high. 30 to 50% of people are going through some kind of abusive experience, and they remember it. The peak age is like maybe 12 years old. So there's high levels of severity, let me say that, at 12 years old. they remember this kind of trauma. And once again, these are people who have been admitted to the psychiatric hospital at least around 2 times. Average age 26 years old. 40%, 42% female. These people were surveyed. So I'm correlating traumatic events to mental disability. All right. Let's look at the next slide. I told you that the not number one, 80% of children, of cases of maltreatment has to do with maternal neglect. Here is a brain. Look at this 3-year-old's brain. This is a normal 3-year-old's brain. Really large. I mean, large, comparatively, much smaller than our brains as adults, but a large brain for a 3-year-old, a normal brain. Look at the size of this young child's brain who's been extremely neglected. And when I describe extremely neglected, I mean orphans. Orphans in Romania in 1989. And these people basically were orphaned after some kind of war, like a regime took over, and they had a whole bunch of people in the orphanages. And when they did the MRI studies of children who've been orphaned, their brain, their cerebrum, their ventricle sizes are enlarged, meaning they have a lot of cerebral spinal fluid flowing through their brain, high pressure, and it's much smaller. When you lose your mother, your father, when you're orphaned, your brain, what they're seeing, there's a probability that it doesn't develop as fast. Glenn, you had a question. Would it be a form of what would be a form of parental non-abuse? One thing I can't do, I can't do psychology and psychiatry. So I don't know the answer for parental non-abuse. I think it was like physical abuse, so you can have verbal abuse, you can have emotional abuse, but it's not physical. So that's what I think. I'm not sure. Anybody who's a psychiatrist or psychologist, feel free to chime in. But look, this is just neglect. This is an example of just neglect, meaning you're living in an orphanage, you've lost your parents. And we need to take this home. Like, think about children who are in foster care. Think about children who are in orphanages, group homes. They've lost the nurturing of their mother, and we need to consider that. But imagine if you have some kind of, a smaller brain. Let's remind ourselves what the cerebrum is. So the cerebrum is a main part of your brain. So your brain is divided into 4 regions, if you remember: the cerebrum, the diencephalon, the brainstem, the cerebellum. Well, the cerebrum is the largest part. It does the integration of sensory information. So you see with the back of your brain. You don't see with your eyes. Your brain allows you to see. You hear with your temporal lobe. You smell with your temporal lobe. You taste with a deeper part of your cerebrum called the insula. All right. Or your cerebral cortex. Your cerebral cortex is the gray matter, but your prefrontal cortex, that's the frontal lobe here. You make the decision to move with your frontal lobe, or you make just major decisions in general. Your personality, your high-level cognitive function is due to your frontal lobe. And if all of that whole cerebrum is shrunken, or if it's just smaller, if it's not growing large enough, you're going to have an issue. Okay, so orphans, not only is their brain smaller, so this is a situation from an orphan as well. Look at the white matter. So this is the white matter here. This is thick, but look at the white matter in the orphan, thin. Okay. This white matter is called the corpus callosum. So the corpus callosum is thinner in children that have been affected by trauma. All right, so not just the gray matter, all your neurons. If you don't remember all the details of gray matter versus white matter, please see my other videos. I've been talking about gray matter and white matter for the last 2 weeks in videos in the past, but just know it's smaller in children that have been affected by abuse. So what does the white matter do? So white matter are the connections between the gray matter of the brain. So you see all this area, there's a whole bunch of axons that send messages. This side of the brain talks to this side of the brain. Why? Because of these commissural fibers here. They make up the corpus callosum. That big white part that I just showed you, that's smaller in children that are affected by neglect, that's the corpus callosum, much thinner. Therefore, there's issues with the brain communicating with itself. White matter allows for the brain to communicate with itself on the same side. It allows for communication from one side to the other. Or it allows for the higher level brains to communicate down to the spinal cord that leads to connection to your body. And if the gray matter is also thinned, then it's going to lead to issues with cognition and making, handling abilities to communicate very well, the brain to communicate with itself. Therefore, you're going to have some kind of cognitive impairment. You're going to have some emotional issues. Why? Because there's parts of the brain that the deep parts of the brain that deal with your emotions must be controlled by the frontal lobe. But if there's a slow connection between what is reality versus your emotion, you won't have that ease of emotional control. So white matter is very important. It keeps the emotional brain under subjection. Through communication, the brain communicates with itself. If it can't communicate with itself, there's a problem. So neglect, we're seeing, not only makes the brain smaller, it makes the brain have a issue with communicating with itself. All right. What about hormone levels? Hormone levels. We're talking about trauma, emotional trauma, in children, and what happens to them neurobiologically, like literally at the biology level. So their brain is smaller, both the gray matter and the white matter. Their hormone levels are out of whack. So this is a study where they basically had children, they took their saliva levels, children that have been taken from the home. They've been taken. Their home was in a disarray, and they took them out of the home and placed them in an orphanage. Okay, and they looked at oxytocin levels in their saliva. They literally studied their saliva and looked at oxytocin levels. So what is oxytocin? Oxytocin is a very important hormone that allows for bonding between the mother and the child, right? When the mother's actually given birth, oxytocin is let out and it helps her contract the baby out. Or when she's breastfeeding, a lot of oxytocin is being released into her bodies to give the muscles the ability to squeeze the milk out. Well, that baby is also interacting with the mother, and there's levels of oxytocin and between the mother and the child that lead to bonding. So it's a very important hormone that stabilizes a child. And I see your questions. Give me a second, Glenn. And so what you see here is when you wake up, there's 3 types of children. There's the unsettled child, there's the settled child, and there is the TD child. I believe this is the normal child. I can't think off the hand what the TD stands for, but this is considered the normal child. When you wake up, you have lots of oxytocin to get you through the day. It's there to give you it's to give you motivation and to move throughout the day. That's why breastfeeding is very important. Now, if you didn't get breastfed as a child, is it over for you? No, I didn't get breastfed as a child, but there's something to that. There's something to that. So you don't have a lot of oxytocin levels. Let me rephrase that. You have a lot of oxytocin levels in the morning, and that you're able to cope during the day. You're able to be motivated during the day. This is a child. But over time, if you go to bed, those levels drop to allow you to have good sleep, right? To allow you to sleep well. You're not activated. You're calm. Look at a child who is unsettled. An unsettled child is a child that has just been taken from the home, just been taken out of the home, and they haven't, they've been in this orphanage less than a year. They have low levels of oxytocin, and they never increase at all. So they have issues with bonding. They have issues with, development and being able to cope. Also, it's low in the settled child. Now, a settled child is someone who's been in the orphanage longer. And even though they have issues with high level, having it in the morning, by bedtime, it's actually spikes up. They're seeing oxytocin levels jump. This is the child who has been settled. And so what they're saying, what the scientist is saying is, naturally they have low levels of oxytocin as compared to a normal child. But maybe they're coping. They've developed coping mechanisms that actually cause their oxytocin levels to shoot up during the day to manage, to survive. And remember, these children, many of them are survivors. So it goes to another level now. So at bedtime, their oxytocin levels are too high, and they might have issues with insomnia. But just to cope, their scientists are believing. I mean, these are all scientific experiments. We're not saying yes, true or false. We're just showing what we're seeing and what may be the issue. So Glenn had a question: is this repairable once it's damaged? When a child's brain is damaged, there's room for growth. There's room for growth. So I really believe it is repairable, but to a certain point. After a while, your brain cells stop growing as adults, right? So when we get to adulthood, your brain cells actually start to prune. I'll talk about that next week. You're getting less brain cells as a child. So you want to manage the issue in childhood fast, because it is repairable when you're in childhood. But once those brain cells stop growing, I think, it's going to be difficult to repair. Yeah. All right. So managing it as children, understanding what our children are going through and trying to manage it then is imperative. It's imperative. All right. So their hormone levels are off. That's what we're starting to see. Not just oxytocin, but cortisol. So I know you probably heard about cortisol. It's a stress hormone. Hey, Rowan, thanks for joining. Feel free to ask questions, guys. So let's look at cortisol, right? Cortisol is an important hormone that is a stress hormone. So there's two types of stress. There's the stress that, is immediate. So let's say you're in Apopka, that's where I'm from, Apopka, and you're running from a bear in Apopka. So what do you have to do? You have to run. You have to get out of there or fight the bear. Most likely you're going to get out of there. So what do? You release certain neurotransmitters in your body and you start to breathe fast, right? Because you need to get in a lot of oxygen, because oxygen is important for energy. That's cellular respiration for those of you who've taken biology, right? You also need glucose to get energy. So you're not going to eat. So where are you going to get your glucose from? You actually start to burn your fats. You start to burn, tell your liver to release glucose out into the bloodstream to give you energy to run. Your heart starts to beat fast. Why? Because you need to pump blood all through your body. So you are afraid. Your amygdala, if you remember your amygdala, that's a very important center of your brain that leads to fear. It tells you to be afraid. It's taking part in all of this. That's immediate. That's a bear chasing you. After a while, those hormones, they're called adrenaline, right? Norepinephrine, epinephrine, they go away, and you calm down. Your heart starts to go down. Your lungs stop racing. But if you're in a stressful situation all the time, that's not short term. That's long term stress, and that's a problem. Because now it's not going to be adrenaline coming out. It's going to be cortisol. And it's actually going to do the same thing. It's going to tell your adrenal gland not to secrete adrenaline. Rather, it's going to tell you to secrete stress hormones called glucocorticoids. That's basically cortisol. And what happens? The same thing. You release sugar in the blood. Right? Your heartbeat starts to race fast. Your heartbeat starts to race. You breathe heavy. Right? Now, but the problem is nothing's chasing you. Nothing's chasing you. But you're in this heightened state of stress. And what's happening is, at awakening, the unsettled child, look how high their cortisol is. Look how high their cortisol is. The settled child is at the same level as the normal child. You should have a little bit of cortisol to just get through the day, the normal stresses of the day, but they shouldn't be high. If they're high, you're in an extreme stressful environment. And what happens with that? When you have too much sugar in your blood, but you're not running, right? The purpose for sugar is so that it can go to your muscles. You start running, you work that sugar out, and it's okay. But if you have a whole lot of sugar in your blood for no reason, you got to get that sugar out. And a lot of the times that sugar is transformed into fat. So there's high levels of obesity with cortisol. You know cortisol with that big belly. We call it a stress belly. Right? High levels of diabetes can happen because of trauma. Anxiety, meaning you think a bear is chasing you, but it's not. Even suppression of reproductive function. All of this happens with chronic stress. And what we're seeing is with children who have been traumatized, they have high levels of that stress hormone in their saliva. Yeah. So not only are they having issues with their cognitive function because their brains are smaller, both the gray and white matter, they're having hormonal imbalances where oxytocin levels are lower or out of whack, and cortisol, the stress hormone levels, are out of whack, which can lead to diabetes, obesity, anxiety, hypertension, high blood pressure, right? Because you want to get more blood pressure to your muscles because you think you're chasing a bear, but you're really not. This is trauma. This is what trauma does to children. All right. Their limbic system. So the limbic system is the emotional part of your brain. The limbic system is the emotional part of your brain. When you feel something's attacking you, that part of your brain is active. Very active to say, be afraid, be very afraid. Now, if you're not in a dangerous situation, your frontal lobe, right? Your frontal lobe is supposed to go back and communicate with your amygdala. It's supposed to communicate with your amygdala and say, hey, amygdala, everything is okay. We've escaped the situation. We're good. But what happens when the amygdala does not listen to the frontal lobe? Right? Or in this case, what happens when the amygdala is very large, larger than normal? And that's what's happening. They see in children, adolescents that have been adopted have high levels or great amounts of amygdala volume, meaning that part of their brain is larger. That means they're saying, I'm afraid. And when you're afraid of something, that leads to anxiety. Anxiety is basically being afraid about something, especially things that should not be scary. Right? They also say that late adoptions, children that got adopted later than earlier have high amygdala volume in social anxiety. So you wonder why people are very anxious and have social anxiety? Don't ask them personally, but ask yourself, what happened to them? Don't say what's wrong with them. That's what I'm going to keep saying. I'm reiterating this, all throughout these 2 weeks of Mental Health Month, the last 2 weeks of Mental Health Month. Stop asking people or other people, like, what's wrong with that person? Instead, ask, I wonder what happened to them. What happened to them? Their hippocampus is the same size. We're going to talk about what the hippocampus does in adults, though, next week. But the hippocampus is the part of the brain that is important for memory. So hippocampus is the same size, but the amygdala shoots up, and that could lead to anxiety. If you look at this picture here is the amygdala, and you'll see that in a later adoptee, you see, that's what it means, much bigger than those who were adopted earlier. That's the picture that they're showing. All right, so that's pretty much it for children. Here's a caveat: not all children who have been exposed to ACEs, but this stands for adverse childhood experiences. That's what I talked about earlier: either peer-to-peer bullying, parent-to-child bullying, parent-to-child abuse, nonverbal, verbal, sexual abuse, etc. Any of those types of experiences is what we call adverse childhood experiences. Many of them, it's hard to study scientifically because it's going based on what people remember, or what they feel. It's just hard to study. So not all children who have been exposed to these ACEs go on to develop a mental health disorder or a substance abuse disorder, one of those ICD-10s. So I don't want to make you feel like everybody, including yourself, who've had traumatic experience, like your life is over, you can't function. But I want you to be more understanding to those, of those who do. Right? So there could be individual differences that play a part in why some people, remember, I was giving an example, like peer-to-peer bullying, 50% of the people who were in the psychiatric hospital, those who were surveyed, 50% of them were bullied as a child. That means the other 50% did not have bullying as an issue, right? And there's some people who've been bullying their whole life and no problem. But what could it be? It could be depending on the stage of exposure. When did this happen? Did this happen when they were 2, 3, 5, 17? Right? When it happens makes a difference. How early in their life did it happen? The combination of many, right? You can have multiple types of abuse that will lead to this more than if it was just bullying or just neglect. That's what I mean by epigenetic programming. etc. Or the duration. How long did it happen? If it happened for their whole childhood, then you may have the expectation of these issues. If it only happened for 1 year, maybe not. As you saw with the children who were settled versus unsettled, they started to balance. They started to go through a survival mode. So we're going to talk next time about what happens to adult neurobiology when they've been traumatized. So today was just looking at the children. Once again, don't ask people, what's wrong with those people? Think about what happened to them. And you start to see that, like, there's some biological issues going on with many of these young people. It's not as simple as they're bad kids. All right. I hope this was interesting to you guys. Thank you so much. You can find me on LinkedIn, Facebook, Instagram, Twitter, YouTube. I'm definitely going to put this on YouTube. And these are the papers that I've read between this week and next. So I'm really thankful to all the scientists that took the time to do many of this type of research. Any questions? Glenn is asking, does therapy help with the healing if caught early enough? Absolutely. We're going to talk about that next time. I really believe in cognitive therapy. I think I kind of addressed it. Let's see if I can go to the previous slide where it says mind and body medicine. Mind and body medicine. When you do cognitive therapy to address the issues of fear, right? Cognitive therapy. Remember, your frontal lobe should be able to talk to the amygdala and say, hey, amygdala, that's not real. What you're afraid is not happening to you now. So you actually have cognitive types of therapy to manage the imbalance of what's going on hormonally. Yeah. So I really believe therapy is the way. Sometimes we use medicine as the way. So medicine will do this. But my issue with medicine is that it's still a drug. It's still something that has side effects. And so, I really believe we have to really go back to, and I think more and more therapists are talking about this, cognitive behavioral therapy, and not simple. Now, is there a need for drugs for high level mental disorders? Absolutely. Am I an anti-drug person? No, but I think we go to medication too quickly, and we really need to just address the trauma and use our frontal lobe to cognitively try to address the trauma. Yeah, mind and body medicine is so important. Therapy is and as a nation, when I say a nation, I mean, this kind of nation, us, we say pray about it. And praying about it is very important. Yeah. Cognitively though, dealing with the issue. See, some of us use religion as a drug. Anything that's numbing the pain of trauma is an addiction, is a drug. Right? So if you're trying to use the Bible and religion as a way to not deal with your personal issues, that's an addiction. Religion is an addiction for many Black people. And what we're using as a way to deal with our issue, to get healed, is not really the real way. So confess your faults one to another, meaning talk about the situation. Have then the positive energy of somebody else praying for you, and then dealing with the traumatic experience, and you and God actually work the pain out. Feeling the pain. If you're letting God allow you to feel that pain, that's what we need to do. And a good Christian therapist can help you with that. Roanne, neuroplasticity is why I will say that yes, the brain can be repaired, maybe not back to its original state, but the brain can change positively. Yeah. See, with neuroplasticity, though, it's heavy in children, high levels in children. So I don't have the picture this week, but I'll show it next week. You know, neuroplasticity, for those who don't know, is the ability for the neurons to multiply and grow and then communicate with one another. And it's excessive in children, right? Very high. So that gives the ability for the child's brain to repair itself. But then when you start getting to high levels of adolescence, 19, 20, then pruning starts to happen and neuroplasticity starts to drop. And so when pruning happens, you're actually starting to kill brain cells and focus them on each other. So they start to really look at each other. So if you're going to deal with trauma, you want to deal with it when neuroplasticity is active, and that's when it's in their childhood. When your child is acting up, you need to really dig deep, because this is the time to change their brain positively. This is the time. So everybody who's working with, social workers and psychotherapists that are working with children, like, we need to start we can't just say pray about it and just, we got to put these kids in therapy. We need to address what could have happened to them while there is still time for those brain cells to grow. Yeah. Any other questions? Well, it was nice talking to you guys, Glenn and Roanne. I got a lot more people who say they were coming, but I guess we got a little bit too busy. Feel free to ask the questions on the replay. I will type the answers in. I hope my session was informative. Next week, I'll be talking about adulthood. Yeah. Adulthood. What happens to the brain for adults who've been traumatized as children? Whether they've dealt with it or not, but most likely those who haven't dealt with their issue. All right, guys. Thanks so much. My name is Dr. Maya Byfield. Oh, I forgot to give you my credentials. I got my bachelor's degree from Oakwood College, now University. My master's and PhD from molecular pharmacology. And I did a postdoctoral scientific fellowship in neuroscience. Once again, I am not a psychologist and I am not a psychiatrist. I just know what happens to the brain. So I am the phenomenal STEMist. I'll see you guys next week. Next week at 6 o'clock, what happens to the adult brain from childhood trauma. Good night, guys.